Everybody, we're going to welcome you. And as you come in, I'm Bart Bettiga. I'm the Executive Director of the National Tile Contractors Association. And we are pleased to present this program on silica. I want to thank, this is the first of a two-part series on silica and silica awareness. Today we want to get into the actual medical components of the condition called silicosis and talk a little bit about that and prevention and cure, and or not potential cure, but how to work with that condition and get into that. And then and we have a great guest to do that. And so we're going to encourage all of your questions to come in. And I also want to thank our sponsor of this program and this event, which is IQ Power Tools. And we're going to get to IQ Power Tools in a second and have him talk about our guest, which is Dr. Andrew Levy, of the who's a representative or a spokesperson from the American American Lung Association, excuse me. So at this point, I want to introduce a couple of NTCA people that are also going to help facilitate, engage the roundtable discussion. Jim Olson, who's the Assistant Executive Director of the NTCA, and Mark Heinlein, our Technical Director. Jim, do you want to introduce yourself, say what you do for the association?
Hi, I'm Jim Olson. I'm the Assistant Executive Director for the NTCA, and I'm in charge of a lot of programs for NTCA membership and our training and education programs. And so with training and education and our membership, this is really important. Silicosis is a very scary situation in our industry, and I'm happy that you're all here. Please put your questions on the chat screen. I'll be monitoring that and making sure, you know, it's not like you're going to be interrupting anyone. Just put them out there and we'll get your answers. Thank you.
Thanks, Jim. I'm going to roll it over to Mark Heinlein, our Technical Director. Mark, introduce yourself quick, and then I have just a quick question for you, but go ahead.
You bet, Bart. Hi, everyone. I'm Mark Heinlein with the NTCA, and I have the extreme privilege of, in normal times, traveling the United States, meeting hundreds and thousands of tile industry professionals. And like Jim said, we include silica and airborne respirable silica awareness training in all of our presentations because it is so important. We get to do that face to face, and I'm glad that we have this opportunity to meet with you today.
Mark, can you give an example? I think we did a big program at Coverings when this first came out. So give an example of the type of training that we're offering so that people know that maybe they should attend either virtually or when we can, after COVID, start training in person, you know, the kind of programs that we're doing on silica awareness.
Yeah, that's right, Bart. We do a lot of training at the NTCA, and a lot of it is hands-on based type tile installation training. Some of it is book type training. It's all standards based, and we do bring in the element of airborne respirable silica awareness. The one that Bart mentioned at Coverings last year, I believe, Bart, that was, we had a very large room at the major trade show Coverings, and we had a lot of static displays set up, tile modules that we could grind on, we could cut tile on, we could do all of these tasks that produce airborne respirable silica. And what we trained on at that event was the ways to use what you're going to hear about maybe today and maybe in session 2 of this, table 1 in the OSHA's guidelines. We used tools and devices that limit or eliminate those airborne respirable silica. And we want to use those things called engineering controls to make sure that we don't generate the dust. So in all of our training programs, when you come and join us, when we're on the road, come to a workshop, come to what we call a regional training program, come to the major trade shows like Coverings, and you can speak with us and work with us, and we'll have tool manufacturers such as IQ there, and we can work with their tools and products in such a way that we're applying these engineering controls so that dust isn't generated and it isn't breathed.
Okay. That's great. Thanks for sharing with that. And our sponsor is IQ Power Tools, and they're a manufacturer of premium power tools with integrated dust collection systems. And they work not just with the tile trades, but they're heavily engaged in the concrete and masonry and hardscape sectors as well. I'd like to introduce the president of IQ Power Tools, Paul Guth. And Paul, maybe you could tell us a little bit about IQ Power Tools and a little bit about some of the equipment that you produce. And then I would like you to introduce our guests that we want to get into with our questions related to silicosis.
All right, very good. Thank you, Bart. Yeah, my name is Paul Guth. I'm the president of IQ Power Tools, and this is Sarah Hurtado. She's our in charge of marketing and communications. Just a little bit about IQ Power Tools. We really are a company of individuals that came from the trades. My brother and myself, came from the trades. I'm actually a bricklayer mason by trade. Did quite a bit of tile work, back in the day, as they say. So I have a really good background of construction knowledge. We developed these tools because we needed them in our business. And so all of these tools kind of evolved out of our business. And, we started getting to a point where people wanted to buy them. And that was a much more attractive business, especially during the construction slowdown, in 2009 and 10, that we actually put our full force into the products business. And our main focus is providing tools with integrated dust collection. And so Mark was talking about those engineered controls. All of our tools like this tile saw and masonry saws have those engineered controls built right in. So when you turn that machine on, it's capturing the dust and meeting the permissible exposure limits that are set out. So that's really been our passion through the years. We came from those trades. We saw the difficulty of meeting the exposure limits, and even just the simple thing of wearing an N95 dust mask. So that's really kind of the core of who we are and where we came from, and it's an important message that we want to spread to everyone. And so it made perfect sense that we got together with the American Lung Association. We partnered and sponsored them to make videos and things and take that message to the end user. And so that brings us kind of full circle here as we work with the NTCA, as a partner with them and to spread this message as well. And then we've invited Dr. Andrew Levy to come on as the expert to really tell us the medical background and what we need to be aware of. So that's how we got here. So
hey, Paul, sorry about that. Quickly before we go to Dr. Levy, or Dr. Levy, I'm sorry. When you guys were launching your products, the OSHA ruling wasn't in place. Did you really see this coming, and what was in your strategic plan? Because this is not to say that this is something you've taken advantage of, but having to minimize dust in the workplace has worked out well for the business model that you have.
Yes, but I can tell you that the OSHA had a plan, a regulation in place. We started this in 2003, 2004, we sold our first machines. And because we saw the difficulty of trying to manage our construction business within the equipment that was available, that made us go out and look for some equipment to capture the dust. It was not available, so we made our own. So the awareness of silica, like I said, that there was a regulation in place since 1977, I believe. And that's one that we were trying to follow. And then, of course, in 2016, 2017, they've revised the permissible exposure limit. So yes, the awareness has definitely stepped up, and now everybody is, looking for those types of solutions. So it's really been a good thing to, broaden the awareness.
And obviously, from the tile industry perspective, once they did that, there were specific tasks that came in that made it pertinent to the tile industry for enforcement, right?
Yes, that is correct. And like you said, we'll get into that, more of those details later on in part two. But so.
Okay, so at this point, we do have a guest, and I thought maybe it'd be pertinent, Paul, if you introduced Dr. Levy.
Yeah, so Dr. Andrew Levy works with the American Lung Association. So again, he's going to be our medical expert on the panel here. So Dr. Levy, if you want to tell us a little bit about yourself.
Yeah, sure. Again, thank you so much for having me today. Thank you to the American Lung Association, the NTCA, and IQ Power Tools. It's an honor to be here and talk a little bit about silicosis. As a quick background, I did a lot of my training down in Denver at a hospital called National Jewish that has expertise in these rare diseases like silicosis. And I did cut my teeth at the Department of Environmental and Occupational Health Services down there, where we saw a lot of patients who had exposures in the workplace. And amongst those patients, we saw a lot of silicosis. So I'm happy to talk about silica exposure and silicosis today and answer any questions you all have.
That's great. Thank you, Doctor, for joining us. I think sometimes before we can get into the deep or the depth of things, we probably should just make sure we all understand, the condition itself before we get much deeper. So, when we say silicosis, I mean, if I just said, what is silicosis? What would your answer be?
So what I would say is it's damage to the lungs caused by extended exposure to silica dust. And I think one of the important distinctions amongst silicosis is that there are various forms that have to do with when symptoms come on. So if you take people who are in the workplace and you expose them to silica dust, they can develop various forms of silicosis. And the way that we name them is based on when the symptoms come on compared to their exposure. And one of the challenges in silicosis is that we often see symptoms years to decades even after people have had silica exposure. So in that way, I kind of compare it a little bit to cigarettes in that, you're having day-to-day exposure and you might not feel a difference and your lungs may feel normal, but you may be putting yourself at risk for disease decades down the line or years down the line. And I think that's one of the big takeaways that I think people in the workplace should have who have exposure to silica dust, that even if you feel fine today, that it's dangerous to be around too much silica dust and you need to protect yourself because you could develop a disease years later.
So you're talking about, starting to perform good habits early in your career to prevent something that, you might not know until much later that's, associated. So talk about symptoms. What are the symptoms?
Sure.
If I think I have it, what is that?
Yeah. So the first thing I would say is that there is this rare syndrome called acute silicosis,
okay,
where you can get symptoms pretty close to your silica dust exposure. So that can occur weeks to months to a couple of years. That's pretty rare. And that in that disease, patients can get shortness of breath, cough. They can get more systemic symptoms, meaning kind of the fever, aches, and pains than we see in more chronic silicosis when patients develop symptoms years after their exposure. So that acute silicosis that can occur pretty early on is very rare. We don't see that often anymore, but it can be pretty dangerous. And those patients can progress pretty quickly to having bad lung disease and even death. And so again, the acute silicosis, you're going to see the respiratory symptoms, that shortness of breath, that cough, but then you might also see these more flu-like symptoms like fever, aches, and pains. When we think about chronic silicosis, which is the more common kind that we're really kind of talking about today, most of the symptoms are respiratory. So are you experiencing increasing shortness of breath when you're doing normal activities of life? Have you developed a new cough that you never had before? So those are the main symptoms. They're symptoms that have to do with your lungs, respiratory symptoms.
Are you silica can be found everywhere, Dr. Levy. When you're treating patients for silicosis, are you finding that it's primarily the construction industry, or where else would people be exposed to prolonged chronic conditions of silica?
Yeah, well, it kind of depends where you're from. When I was working in Denver, I saw miners actually who had silicosis. So hard rock mining. Anytime you're like you said, silica is everywhere. Quartz is kind of the silica that we worry the most about because it's the most common. But anytime you're breaking into the earth or cutting or grinding or processing stone or artificial stone, you're generating respiratory or generating silica dust that you can then breathe in and cause damage to your lungs. And so anything that does that can cause silicosis, and that's a lot of different jobs. So, you know, we see people who are miners, sandblasting, really common within the construction field, obviously. People who work with ceramics, foundry work, there really anybody who works with stone and is generating dust should be concerned.
Thank you. Appreciate that. Mark, I'm going to put you on the spot. We were trying to get a guest, a specific tile installer, tile contractor that actually has this condition. And I think that might help in this conversation a little bit. Maybe you can describe what you've heard, Mark, in the field, and Dr. Levy can maybe chime in with what's been happening with an example or a case study of an installer that we know of that has this condition.
Hey, Bart, before we go to that, can I ask Dr. Andy something?
Sure, of course.
So with the COVID situation going on, and I don't want to get in that direction, but it seems like the symptoms are very similar, right? Respiratory, headaches, fever, those kind of things. Are there certain things we should be looking for to distinguish between those two? You know, before we get off in a new direction.
I think that's a really important question. So again, when I was talking about the fever and the kind of the acute silicosis, that's a pretty rare syndrome. It's not that common that we see that, especially these days where we have kind of closer monitoring through OSHA of the amount of silica that people are being exposed to. Mostly silicosis tends to be a respiratory disease, and it doesn't come on that quickly. This is something that tends to come on over kind of months to years. It doesn't move that quickly. Coronavirus or COVID-19, which is the disease that coronavirus causes, comes on right away. It's like a flu-like illness. It's going to be a day to 2 days. So what I would say to your workers is that, you know, if you're having sudden symptoms, it's much more likely right now to be part of this pandemic than to be part of exposure to silica. If you have noticed that you're having, you know, continued progression of your shortness of breath with exertion, that your cough is getting worse, you know, obviously if there's a sudden change, you should seek help, but otherwise that may be silica. That kind of slow change over years is more consistent with silicosis.
Thank you.
Yeah, before I go to you, Mark, Paul, I'm wondering, either you or Mark, because you guys work in the field more than Jim or I do, is that a silver lining? Jim's question, very good, related to COVID. You know, the fact that it's installation crews on a construction job site have had to practice some social distancing and try to be very, very safe. You know, is that helping with awareness related to compliance with OSHA and the silica rule?
Well, I can tell you from our standpoint, one of the things that is interesting now that everybody knows what an N95 dust mask is. I mean, my kids know what that is, my wife. So, I mean, that used to just be something we encouraged everybody to wear. And now people are recognizing what it is and why it's important. And just talking to Dr. Levy's point, you know, that acute silicosis, that's really, if I put that into what that means to our guys, let's say a guy was going into a room and he was grinding on a floor, you know, for maybe 1, 2, 3, 4 days. There's no ventilation. He's wearing no respirator. He's really getting overloaded with silica. And that's how they come out of there with those flu-like symptoms. They can't breathe. That's an acute silicosis. So that's what, and now most people know, at least be wearing something like this, put some ventilation in place. You know, don't put yourself in that circumstances. Most people understand that. So we're seeing less of those types of cases. But the chronic one is definitely, you know, the one we're more worried about. And I can tell you with the COVID, if you have some level of silicosis, that dust that's been trapped in your lungs, you're more now susceptible to COVID because you have a weaker pulmonary system. So they do definitely go together.
Yeah,
Quick question. I'm going to chime in real quick
Yeah,
about
go ahead,
chronic silicosis. We have somebody, Mosaic Tile Guy on Facebook, sharing that he's been doing this with the dust for 20 years, but recently been covering his nose and now getting a lot of pain in his arms and legs. Is that something that could be related to silicosis? Should he maybe see a doctor?
So sorry, he's getting pain in his eyes.
In his arms and his legs.
Well, you should definitely see a doctor. That, that would not be kind of a classic symptom of chronic silicosis. It's more likely that's probably related to some other disease. Again, this is, we can, I'm sure we'll kind of get into, we can get into it now if you want. There are some other manifestations outside of the lungs that have been shown to develop in patients who have a lot of exposure to silica. There seems to be an increased rate of kidney injury, chronic kidney injury, associated with silica exposure. We don't fully understand why that is. You think about it, you're breathing in the dust, it's staying in your lungs. It should really be mostly a respiratory illness, but we are seeing some kidney injury. And the other thing that we've seen associated with silica exposure is autoimmune disease. So we've seen increased rates of diseases like rheumatoid arthritis and scleroderma, which are autoimmune diseases. So, conceivably a disease like that could cause muscle involvement and pain and weakness in arms and legs, but it's really hard for me to, diagnose that based on just those symptoms alone. But I think it's just important to be aware that it's not just your lungs that can be affected by this, that they're, the kidneys and this development of autoimmune disease have been clearly demonstrated in people with prolonged silica exposure, kind of years after the beginning of their exposure.
I'm going to ask a question from our audience real quickly. So are there any risks to carrying the silica dust home to your family members on clothing and other items like that?
So that is a great question. I haven't read anything published, but we can kind of extrapolate from other data in other diseases similar to silicosis. So we know, for instance, that workers who work with a lot of beryllium, if they don't kind of clean and change clothes, they can expose their family members to diseases associated with beryllium. And so the recommendations are that if you are working with a lot of silica dust, that you wash off to protect yourself, but then you also change your clothes so that when you go home, you're not kind of having your home covered in silica dust and not exposing your family members. So there hasn't been anything clearly demonstrated, but I think it's a reasonable common sense step to take to protect your loved ones and also to protect yourself. You just don't want to kind of have that dust sitting around at home and recirculating and exposing yourself all over again when you've kind of let your guard down. So I think it's just good practice, and it's what OSHA recommends, I know.
Dr. Levy, on the mask that Paul showed, we hear this all over the place from people, these masks don't work. What are they good? There's the whole COVID discussion about should I wear a mask? Should I not wear a mask? How effective are these masks at least as related to preventing the inhalation of silica dust and dust particles and things of that nature?
They're highly effective. They're kind of in the name, N95, 95% of particles, but it's been demonstrated that the blockage in N95 is good for preventing silica inhalation. There are some densities of silica dust where we recommend even kind of more powerful protection. But an N95 is a wonderful tool for kind of most levels of silica at the work site. So, and you guys can kind of go into that with a little bit more detail. Sure. I'm not totally familiar with kind of the levels that are on an average tile contractor work site, but N95s are excellent protectors from silica dust.
Certainly a good first step, that's for sure, in addition to other things that we do. Mark, let's talk about a specific example. I think that would be very informational to our audience.
Yeah, and Dr. Levy, I come from Michigan's Upper Peninsula, and I am really glad that you connected us with hard rock mining. Hard rock mining is still to this day very prevalent in the UP. And those who live there understand silica and where it's generated. Now, as a tile contractor up there, the miners knew all about it and how to protect themselves. But as the tile contractor, I knew about it, but I didn't really know I should protect myself, and fellow contractors like me. And now we're just learning. And so I'm glad you connected us to where it comes from. And we do have a dear friend in the NTCA, one of our tile contractors, the guy who started at his father's knee, second or third generation family business in the tile industry, mixing products, cutting tiles, installing tiles, doing whatever his dad and uncles needed him to do. And he's still relatively young. He's not an old guy by any means. He's younger than I am, that's for sure. And he tells me that sometimes when the weather's warmer, in the summer, it's kind of humid, and he does commercial work. He's with his crews, and the crews are working, and it gets a little hot inside, and he gets to the point where he can't breathe. And he has to leave the building, get outside, and have somebody actually bring him to the hospital for some respiratory treatments so that he can breathe again. And he does actually have silicosis that is just not improving, and it's very difficult for him. And he's a hard worker, tough guy, but boy, it gets him down quickly. So we see him, he's a great guy, but boy, he struggles.
Yeah.
And it's tough. I can say that I have been that guy. Jim, you asked that question from our audience. How do you bring this stuff home? Does that affect everybody? Like, dust off your clothes, right? And it's brushed, that dust goes everywhere. And it's all over your garage, your car, your truck. And for many years, I didn't consider that. So I'm really glad that we're starting to get this information out. And I'm glad that everybody here that's attending and listening today is paying attention to this and understanding that this is more than just the law. It's more than the government forcing us to try to force us to do something. This is for our own well-being and our family's well-being. So, our friend, I don't want to see anybody else out there have this.
Yeah, what I would say is that what happened with hard rock miners is a little bit of a cautionary tale. When they did there was a study done in the late 80s, I think early 90s, where they looked at chest x-rays for hard rock miners, and they found evidence consistent with silicosis in up to 30% of those miners. Granted, they didn't have the same knowledge of silica dust or the same respiratory protection or the same kind of monitoring, governing bodies. But I think that's kind of the worst case scenario if you let your guard down, is that, a lot of people can develop disease. And like we talked about at the beginning of this, the important point is the things that you're doing today, the systems you set in place, your daily practices, it's not going to affect how you feel this weekend or next week. It's going to affect how you feel decades from now. And you're going to get to that point like Mark's friend is, where you have discomfort breathing just when it gets humid. And so the manifestations of this respiratory disease can be pretty dramatic. And so just to reemphasize that this is something we need to protect against now to prevent problems later.
Yeah, we hear from a lot, Dr. Levy, that it's from the superintendents or the foremen that manage the crews. The business owner will share with us. I don't know if Mark or Jim would echo this, but that, sometimes the workers, they think it's a pain in the ass, right? To have to use this equipment, to have to wear a mask. And, hey, I only cut with a dry cutter for 30, 40 minutes a day, I shouldn't be at risk. It's not 4 hours of prolonged exposure. What kind of advice would you give to a business owner about the importance of training, the importance of implementation of safety and best practices, so that, we don't have a horror story like kind of what you just indicated, which is like 30% of a workforce 40 years from now that have these conditions such as this?
Yeah, I mean, I think you need people to want to do it for their own sake. No one likes to be told what to do. Doctors don't like to be told what to do. We ignore our supervisors. And so a lot of it is just kind of continued education and education that people can participate in rather than coming down from above. And I think it's important to kind of, like we're talking about, how a patient's family can be involved in their decisions of what they do with silica dust at the workplace. I think that's something important to emphasize as well. And so it's, this is a similar discussion that I have on a daily basis with patients who smoke cigarettes. Obviously, there are important distinctions between people who are exposed to silica and people who smoke cigarettes, but it's the same kind of, today won't be a big deal. Today won't be a big deal. But when you add up those daily decisions, it creates this big problem down the line. So I think really just kind of motivation rather than, hard edicts just tends to be more effective.
Yeah, I think when it comes to motivation, maybe Paul, maybe you can show them the little silica demonstration you have on your desk there. I think that's very motivational for what people need to see and understand. A good visual is better than all these words. So
yeah, and that's why we're simple construction guys, and when we started digging into the regulation and really what the basics is, we wanted to try to break it down so we can visualize it and understand it. And what we've done here is these test tubes hold basically dust from cutting. And so we took the current OSHA silica regulation, and you can't really see it, but there's a very small amount of dust in this vial. It would barely cover half my fingernail there. And this is the amount of dust that OSHA is allowing you to breathe within a 1 week period. So I don't know if you can even see it there. So that's 1 week's worth of dust. And that's assuming that there's a 10% silica content. This, you can start to see that's 52 weeks. So that's 1 year's worth of the regulation that you're allowed to breathe. Then if you take this vial right here, you can see it's full up to there. That's what happens when you make one cut. That's the amount of dust when you make that one cut that you've released into the air. And of course, now you're walking around in that dust cloud and you're breathing in a certain amount of that. And the important message that I always try to teach, especially young people, because even for myself and Mark, we have some form of silicosis already. It's a little too late for us, but we want to make sure that the young people know that any of that dust that you breathe into your lungs goes in to those little modules that creates a little piece of scar tissue, and that little piece of your lung dies. You just lost that piece of your lungs, that capacity. The more you do that, the more you are killing off your lungs. And then, and I know our friend, that Mark is talking about, he's not an old guy, and, I'm sure he's got kids and he wants to go run around and kick a soccer ball with them and play football and things. And I'm sure it's, affecting his daily life. So that's really the message. It's not just dust. It's very dangerous. We need to protect ourselves, wear the mask, use the engineer controls, whatever it takes to protect ourselves. So that's just, that really, when we laid it out and showed the amount of dust that is being let into the atmosphere, and then, it's not only yourself, but your workers and the electricians and everybody else around, you're putting that dust into the air for them as well. So it's the right thing to do to protect ourselves.
Yeah, if you're a business owner, if you're a worker and it's you yourself, it's your body, it's your responsibility to yourself, to your family. If you're a business owner, there's the ethical responsibility of providing a safe workplace for your workers, but there's also the business component, which is compliance to an OSHA ruling, which of course we know exists on commercial projects and eventually will I think trickle down into residential projects. Those fines have started to happen and can happen. And more importantly, as importantly, there's the costs associated with medical costs if your workers come down with not just this condition, but possibly other conditions related to not practicing safe. Dr. Levy, you talked about cigarette smoking. We all know the construction industry. Lots of guys smoke cigarettes. Lots of guys are inhaling dust. Lots of guys are exposed to silica. What's the risk of a heavy cigarette smoker with this condition, and how is that related?
Yeah, I mean, that's a great point. So there's clearly, they worsen each other. So if you smoke cigarettes and have silicosis, you're going to have worse silicosis than your buddy next to you that doesn't smoke cigarettes. There's a clear worsening of the disease.
Andy, let me ask you, when I've read about silicosis, my understanding is at this point, there's no cure, right? I mean, is the American Lung Association working on something, looking into that? I mean, can you tell me a little bit about what direction the American Lung Association is going to help this situation?
I think it's become, two things have happened. One has been that it's become a less common disease. And so kind of the collective money out there looking for a cure for a disease that has become less common is decreased.
Yeah.
So it's kind of a good problem to have almost, but there's a little bit less drive to find a cure for something that you all have been increasingly effective at preventing. It's a complicated thing. I think, like Paul put very well, it's this building up of scar tissue from chronic exposure. And so as you can imagine, there's not going to be an answer to that turns around very quickly. There have been some
another way. It's really another reason why we should be taking care of ourselves, right? It's why each installer, each contractor needs to be looking at every way they can to control that dust and that silica.
Yeah, but
right?
Jim, to your point, the thing is, there is no cure, but the disease is completely preventable.
Right.
That's the point. If we take the steps, we can prevent the disease. And that's kind of the message that we have partnered up with American Lung Association. It's just to let people know, yeah, there is no cure. Here are the symptoms. They're all very scary and not pleasant to talk about, but this disease is completely preventable. So take the right steps. And that's really the message.
That's where I was trying to go with it, Paul. Thank you for putting that through for me.
I mentioned that I get to travel around the country and I meet with many of our NTCA member contractors, sometimes on their job sites, oftentimes at their shops. And one of the things that I find is that they're very well educated on this based on the education we've been doing at our trade shows. And they have the tools like Paul's company manufactures and sells, and they're familiar with the tasks and what it takes. It's just become everyday work for them that they're protecting themselves, and that's all through education and information, and it really makes me happy to see that when I visit.
Mark, do you think that's a lot on the commercial side, or do you feel that that's actually translating to the individual worker or the residential guy that's out on job site because he or she controls their decision making? They're not being told that they need to wear PPE.
That is a terrific question, Bart. And I would say that's mostly on the commercial side, that they're mostly aware of this. And the business owners that you just described a couple of minutes ago, they're seeing it as an opportunity to make their business cleaner, seen cleaner by their clients and their general contractors they work with. And their employees have just come to accept it and understand that it's what helps keep them healthier and their costs down in that respect. On the residential side, you know, there are some very savvy people out there that care a lot about themselves and their customers, a lot of them. And they're doing it for themselves, but I think that they really haven't yet realized that this is something across the spectrum that they need to do and get behind.
Dr. Levy, I'm sorry, was someone going to say something?
I just want to ask him something, Bart. I'm sorry. So a question came in on the chat screen, and it's again related to the COVID situation, that there's a real difficulty getting the N95 masks right now. It's very hard to get. So there's these new masks, or a mask, the KN95. How do you feel about those? Or Paul, maybe you can answer. How do you feel? I mean, are they as good? Or explain what KN95 means to, you know, to our audience.
Paul, you want to take, do you have an answer for that one?
Yeah, actually, I do not have an answer. I'm not familiar with those.
So they're kind of the Chinese manufactured version of the N95 mask. What I'd say is they're probably better than nothing, but my guess is that we don't know enough about them. We don't know enough about them in terms of coronavirus, but I suspect that we do not know enough about them yet in terms of silica exposure.
And you're talking about the supply problem. Yeah, we definitely, we went out of stock, for the nation and pretty much the world there, but it is, coming back online. I'm seeing them available at construction supplies, and, so they are becoming more available. So, but like Dr. Levy said, I think anything is better than nothing if they have a choice. So,
yeah.
I have a quick question.
Go ahead, Sarah.
I can interrupt from Facebook. Mark is asking, what about amorphous silica? Some hard surface product manufacturers are stating it as a safer form of silica used as a component in their products. Can amorphous silica become crystalline when cut or processed?
So what I can say is that amorphous silica is less reactive to the lung. So it's the crystalline silica like quartz that really causes the damage. And we haven't really seen silicosis with amorphous silica. I tend to be, I'd have to read a little bit more about the manufacturers and the product to comment further.
Yeah, and
Dr. Levy, could you tell us what amorphous means? What is that exactly?
Yeah, it has to do with the structure of the silica on like the microscopic level. So crystalline obviously lines up in a more regular kind of grid fashion, whereas amorphous is what it sounds like. It has less of a shape, and for whatever reason that exposes the lung to less damage when it deposits in the lung. It's clearly the crystalline silicas, of which again quartz is the most common, that when they deposit in the lungs cause a lot of local inflammation and then eventually scarring and damage. And we just have not seen that association with amorphous silica.
Yeah, just to kind of go along with the crystalline silica are like shards of glass, and they have edges that really get into the tissue and embed themselves. The amorphous, I think the idea behind that is that maybe it can be expelled a little bit, like more of a common nuisance dust. But again, you got a dust cloud here. There's amorphous, there's crystalline. Right. How do you start to differentiating? So I mean, to me, all dust, wood dust, any dust is dangerous. Keep it out of your lungs.
Dr. Levy, you mentioned that silicosis is decreasing. Is it due to what we're doing here, awareness? Is it due to regulation, obviously, or is it due to silica being used in less products? Why is it decreasing that you see?
Well, I don't think it's silica being used in less products. I think it's probably a combination of increased regulation and awareness. You would think that sometimes people wonder, are we imaging people more often? Probably, and yet we're seeing lower rates of silicosis. So I think we're doing a better job of protecting people. There are less people that are doing things like hard rock mining or very high risk activities for silicosis. So that may be contributing as well.
So how does one get tested for silicosis? How do you begin treatment? Let's talk about treatment. Okay.
Sure. So the testing is mostly clinical, meaning when a patient comes in and they've had significant exposure, we look for the signs, which is an abnormal X-ray, and that abnormal X-ray can show spots or nodules where there's scarring from the silicosis, or it can even show kind of big abnormal consolidated masses, what we call progressive massive fibrosis in the lungs from silicosis. So we're looking for the only reason I mentioned that is that we're looking for typical X-ray findings and then an exposure, and then we evaluate patients' symptoms and degree of lung disability through things like breathing tests. And based off that, we kind of make decisions on what treatment they should get. As we've mentioned, there's no cure, so all the treatment is kind of to support their breathing dysfunction. So if they're smoking, we strongly recommend and we help them in quitting smoking. If their oxygen is low, either at rest or when they exert themselves, then we recommend supplemental oxygen. And then one of the most important things in any patient who has a lung disease is to kind of go through pulmonary rehab or reconditioning. So to get some supervised exercise where they get into better shape so they can compensate for their lung injury. But there's no kind of magic cure. It's mostly the normal stuff that we do for people with lung disease.
So if you get, is there a risk of this developing into other things like tumors or things like that?
There's an increased rate of lung cancer, probably just from having all this inflammation in your lungs. Usually it's not the disease that we see itself that turns into cancer. So it's not like the disease from silicosis in the lungs is a precancerous lesion or tumor. It's more that we just know that these patients with silicosis have a higher risk of lung cancer. So we kind of keep an eye out looking for something that looks like it could be early lung cancer.
Okay, Mark mentioned a worker. He's relatively young. So to put you on the spot, I'm 40. You determine that I have silicosis. You're starting to write out a plan for me on treatment. Can I continue to work? What do you do? I'm in the construction industry. What's my process?
Yeah, it's tough, right? I mean, people love to do what they do, and they have their passions, and you hate to take people out of a job that they're good at and they find rewarding. But if you're developing silicosis, you really need to be taken out of that exposure because you've demonstrated a susceptibility to developing this disease. Not everybody has that. There are some people, and we don't know why, that have the same exposure as the next guy and they don't develop silicosis, and the other guy does. And so we know that people that are developing silicosis are likely to progress, and they could progress to end-stage lung disease, either needing transplants or dying from their lung disease from silicosis. So we recommend strongly, and we run into a lot of objection, which I understand, that people don't want to leave their jobs, but it's really important that they not be exposed to further silica. And you can do a lot of protection, but it's just not going to ever be perfect for these patients who are already sick at a young age. And so we usually recommend that they remove themselves from that environment.
So if you're a worker, if you're an installer, if you work for a business owner, a good suggestion would be to look, develop some estimating skills, get into the
Yeah.
office, do some other components of our trade, right? That would be good
Perfect.
advice. Yeah.
Yeah, I think that's a perfect way to put it, you know, that this doesn't need to be completely life altering. You just need to find a way to keep working that doesn't involve daily silica exposure.
Well, and we know there's no cures for certain conditions, but we know that with the unbelievable advancements in medicine, that people are living long lives, even with the condition. Are you seeing that with the treatment for silicosis?
Yeah, I think we've come a long way, and kind of exactly as you put it, in treating people with chronic lung disease and helping them achieve a better quality of life. In Denver, we had a patient with silicosis who's pretty young get transplanted, and he had a good outcome. Obviously, a lung transplant is not something that any of us imagine would be in our future, but it's another kind of tool we have to help people who've kind of reached the end from a lung perspective. But yeah, certainly people are doing much better than they did 10, 20, and definitely 30 years ago in terms of living longer and living a better life with this disease.
And I know Jim mentioned earlier COVID, and I know this is early, but is work being done to try to understand if you get COVID, are there more risks later from that towards things like this? I mean, or is this way too early to know?
It's too early. It's a great question. You know, we are in our COVID patients, we are seeing kind of this syndrome of prolonged shortness of breath and respiratory illness, even after they've recovered from the virus. So, you know, will that translate into an increased susceptibility to various lung diseases? Maybe, but you know, you're taking silicosis is a pretty rare disease, and you know, we won't have enough data right now to make a judgment one way or the other. The other part of it is that silicosis happens longer down the line, so it'll be hard to say.
Dr. Levy, we have a question that came in on the chat screen here, and the question is, how long before you send your worker to be tested? And I'm assuming if they're showing symptoms, they probably should go right away, right? I mean, don't wait.
For silicosis or for COVID?
For silicosis.
Yeah, definitely. I mean, I think if you have a worker who has new shortness of breath, they should see a doctor.
Okay. Quick question from Facebook. You guys talked a little bit about like it's a compound problem, you know, once you start breathing it in, you're breathing it in. But what about, is there any science behind if it affects women more versus men, or a certain race or nationality?
Yeah, so there's good clear data that Black workers are more susceptible to silicosis given an even exposure compared to white workers. I don't know about the gender differences. I don't know if you all know or can answer that.
Yeah, and I know we have a significant Hispanic population in the construction industry, but you don't see trends towards that?
I haven't seen data for that. I mean, I would not be shocked if it existed based on kind of other diseases, but I've not seen data for that.
Very interesting. Jim, Mark, any other questions? I guess I have one, doctor, because it just came to my head. It might be a dumb question. We hear a lot, you see the ads about mesothelioma. You know, that's from asbestos exposure. Can you give me a difference of mesothelioma, silicosis? Are they related?
Yeah, I can't think of what asbestos is. It's a different kind of fiber that ends up in your lungs. It'll come to me in a second, but it's not a crystalline silicate. But asbestos, we know that exposure to asbestos, which has to do a lot with things in the shipping industry and insulation, can cause a variety of lung diseases. It can cause a disease of the lining of the lungs, and that can develop into a tumor called mesothelioma. So it's not a lung tumor, it's a tumor of the lining of the lungs. That's very, very rare, but is a real thing that can happen with asbestos exposure. Asbestos exposure can also cause disease in the lung, it looks very, very different from silicosis, but would present the same with shortness of breath and cough. And it would be hard to tell the difference looking at the patient, but looking at their CAT scan, we could say, oh, this looks much more like silicosis. That looks much more like asbestosis. And again, mesothelioma is a tumor of the lining of the lung. That's a very rare disease. Again, something that we're seeing less and less frequently, but you see a lot during commercials on TV. You will see.
Asbestos is a heat-resistant fibrous silica mineral.
So I think it's an amorphous silica.
Amorphous, that's what I'm thinking.
Silica,
too.
yeah, that's right.
Paul, I wanted to talk to you for just a second. We talked a bit about the masks, and I don't want to stray away from our medical discussion here, but the masks are great, and they're not, however, the primary point of stopping or ingesting silica. It's all about these engineering controls, and I think we're going to talk about those more in our next session. But there's a table in this OSHA regulation that defines those engineering controls, and you don't really get to using the masks until you've exhausted a lot of those controls and tools first. Then once you do get to using the mask, isn't it rather complicated to be fit tested for a mask and make sure that you can breathe while working, while wearing the mask, and you're using the right mask? It's kind of complicated, the mask thing, right?
It's very complicated. And really the mask is the last resort. And we say a mask, it, could be respirators with cartridges and you do need to be fit tested. And that was one of the real challenges we had within our company, is we had to put a pulmonary program, respiratory pulmonary program in place, which means we needed to have our employees go out and get a pulmonary test before they could be fit tested. And then they can't have facial hair. They can't be smokers. So that right there, smokers and facial hair, that eliminates, our group right here we have. So we really said, okay, we saw it almost impossible from a respiratory fit testing program. How do we go about capturing that dust before we let it loose? And that's engineered controls. And that's really what we focus on, is capturing the dust where the dust is being generated. That way it never gets into the environment and nobody can breathe it. So that's really what we focused on our attention. And that's why, because the respiratory program for mask is a very challenging thing to do. I don't want to discourage anybody from wearing a mask. I mean, do it all. Use engineered controls and wear a mask. Do as much as you possibly can. But engineering controls are really the most effective.
So, Paul, how effective is that? I mean, when you create a dustless saw, is it creating no dust? How effective is that?
No, there is some amount of dust that is escaping, and it really depends on the different materials you're cutting. We actually have a small little room that we close up. We put the machine in. It has a real-time dust monitor on the wall, and so we can know exactly what that exposure level is. And what we've had to do is do all that testing, put the monitors on, our test people, do a full 8 hours of cutting so we can generate the white papers to show, do we meet the exposure levels outlined by OSHA and the regulation? And of course we do. But there's also some things that maybe, certain operations you can only do for 4 hours a day. You can't do them 8 hours a day, or else you would be overexposing that person for a full work period. So those are some of the types of things in the regulation that we can get into later. But there are options available. Engineered controls are really at the root of that. We talk about even adding water, which, we have all dry cutting machines. That's been our specialty, to capture the dust. But when we were cutting masonry years ago, even with wet cutting and using dust to suppress the dust, there's the guy standing there and there's a beautiful mist, around there, especially on a hot day. and you're breathing in that mist, it's actually quite pleasant. But within those, modules of water particles is silica dust that you're breathing in. So it was kind of a shocking thing to us early on that, our guys had to wear a respirator even when they were running a wet masonry saw because of that mist. So those are the kind of things that are outlined more in table 1, and we can get into more in detail, but engineering controls are the first step.
That'll be a perfect segue to part 2. So I don't think we've set a date yet for part 2. It's going to be after the holidays, right, Sarah? We'll do it sometime in
Yep, we're
January.
looking mid-January.
And I think, Mark, we'll look to you to kind of lead that session for NTCA as we get deeper into the actual table 1 and the compliance of the OSHA respirable silica rule. Sarah, were there any other questions for Dr. Levy? We're out of time, I think, so I wanted.
Nope, we look like we've answered everything that's come through on social media, so we're covered here.
Yep.
All right. Well, I would like, good on my end too. So I would like to thank Dr. Levy for participating with us, representing the American Lung Association. Paul and Sarah, NTCA is indebted to your support and your sponsorship of our programs and our activities. And thank you for hosting and sponsoring this webinar. And Mark, thank you for supporting NTCA and participating in this roundtable. And thank you to all of our guests that came in and asked some good questions. And with that, I'm Bart Bediga with the National Tile Contractors Association, and I want to thank you for joining our webinar of the first part of a 2-part series on silica. Thanks again.
Right.
Thank you, everybody.
Thanks, everybody.
Thanks, guys.
Bye-bye.
End.